So, Mr. Speaker, I know obviously the state of West Virginia has been hard hit by the opioid epidemic. Now we're facing a year-long pandemic. How do you think the pandemic has impacted the efforts that have been in place at the state level, all the efforts that you've put in place with the opioid epidemic and trying to control it?
Well, sadly, Carol, I'm not sure we know yet. Until we get on the other side of it, I don't think the country knows what the full implications of the past 10 months have been or will be. I do know that we have been just crushed here in West Virginia by the opioid epidemic for the last really decade or perhaps even more. This legislature over the course of the past 6 years has passed pages of legislation designed to deal with our opioid crisis here at the level of treatment, at the level of law enforcement, at the level of disposal, at the level of procurement, regulating pharmacies, physicians, healthcare practitioners of all kinds. And we're in a bit of a period now in which we're trying to just wait and see what the impact of all that legislation over the course of the past 6 years has been and will be. But the pandemic is really just part of it's one more thing that we have to wait and see how it fits into the overall portfolio of things we've been doing for the last 6 years. We haven't solved this problem yet, but we hope we've at least taken a couple of bricks out of the wall.
So, from what the efforts that you've made, what do you think has gone particularly well? And if there are collaborations, public-private collaborations that have worked well, that would be great. Well, I'm just, we're looking for some success stories, but we're also going to ask you about some of the challenges that you still have.
Sure. We've sought a lot of input from healthcare providers, particularly frontline doctors. And they have really helped us shape our policy over the course of the past 6 years. For example, one of the steps we've taken has been limiting the amount of opioid that can be prescribed in a particular dose here or in a particular prescription. Not dose is not the right term. In a particular prescription here in West Virginia. That's been met with mixed reviews. We have patients and people who suffer from legitimate long-term medical conditions who are inconvenienced by the fact that they can't get a longer-term prescription now. But that's balanced against providers who are now telling us that they have seen less abuse of prescription medication because people aren't coming to them now for a 6-month supply of an opioid, for example, or whatever. I'm not a physician, but whatever the longest term possible for an opioid would have been. They're now that we've managed to increase patient provider contact by shortening the amount of opioid that can be prescribed. And that's turned out to be a good thing, I believe.
And what about the efforts on prevention? Do you feel like there's enough being done there? I certainly understand the provider piece, right? That's critical. It's critical across the board, across the country. But are you doing enough in the state of West Virginia on the prevention front?
Well, are we doing enough? I think the answer is we can always do more. We've dialogued a lot with our healthcare providers. We're starting to talk a lot more now with our educators. How do we actually push that conversation farther and farther down the age ladder, so to speak, so that we've got younger and younger people understanding the devastating impact that substance abuse, really of all kinds, has on people long term here in West Virginia. We've been trying to work with employers and our employment organizations here in West Virginia to put in place some disincentives for substance abuse at the employment level here in West Virginia. We know there's not a silver bullet for this problem. We know there's not if there were a single solution to this problem, somebody in some state would have found it and we would have incorporated it by now. And if someone does find it, we'll pick it up tomorrow. But until that happens, we're trying to combat it with every small step we can, up to and including law enforcement. I mean, we know that sometimes the only proper course of action is a law enforcement option. We've worked a lot with our law enforcement organizations here in West Virginia, and we know that we may have swung the pendulum too far in some circumstances, and we've got to evaluate that. I spent part of the day yesterday in a conversation with some county sheriffs, asking the question about just how do we enforce some of the things that we, the legislature, have imposed on county government and county law enforcement. And we've got to look at whether we may have put too much on our county officials and whether we're expecting the right things of the right people. So could we do more? Yes. Where the appropriate place to do it is, I think, still an open question, at least for us.
And when it comes to the opioid epidemic itself, what do you think are the greatest challenges that you need to address there in the state?
Well, it's several fold, right? I mean, the overall health condition and the overall health situation of so many West Virginians is chronically poor. We know that we have a number of underlying medical conditions here in West Virginia that themselves can lead to substance abuse and opioid abuse, and that's a problem. So we have an overall health problem, health maintenance problem in West Virginia, not so much health care problem, a health maintenance problem. Is just simply getting people healthier so that they aren't facing some of the crippling conditions that can lead to opioid abuse. On a more theoretical level, though, Carol, I think the problem is simply one of lack of economic opportunity. And I've said that for years, that if a person has a well-paying job to get up each morning and go to work to fulfill, that is in itself a disincentive for substance abuse. So part of why we work so hard at economic development here in West Virginia is making sure people have that well-paying job to get up and go to work to fulfill every day, because that's a disincentive to do a number of other things that lead to some poor lifestyle choices, including substance abuse.